Are we ready to do the roll call?
Evan, are you ready?
Yep.
Okay.
Okay. All right, we're going to do the roll call for the June 16th Gateway Head Start Policy Council meeting. Tammy Holbrook. Brittany Howard.
Here.
Hey, Brittany. Teresa Holbrook. Nakia King. Danielle Knox. Stephanie Masters.
Here.
Hey. Kevin Ferguson. Joe Klein. Amanda Skaggs. Katie Stewart. Brittany Watkins. Megan Willoughby. Courtney Bevan. Corey Carter. Rusty Hedrick, right? Did I get that right, Rusty?
Hedrick, yeah, present.
Right. Cy Powell.
Here.
Chastity Eisen. Amber Hutchison. Hannah Schrader. Mary Belcher. Antonio McAdams. Jamie Burton. Jacqueline Berry. Erica Scott. Joanna Bloomfield. Tammy Stamper. Carol Jones. Kelly Thomas. Brittany Spencer. Vanessa Adkins. Stephanie McDaniels. Rihanna Corey. Tracy Terrell. Philip Price. Nadine Willoughby. Jessica Barker. Emily Mays. Camilla Lawson. Patrick Stratton. Amber Shrout. Sarah Collins. Lori Coaching. Kathy Mills. Amanda Owens. Sherry Carter. And Brianna Cooper. So, do we have enough to establish a quorum, Martina?
Yes, we do.
Okay, so a quorum has been established. We'll continue on with the meeting. The first order of business is April 21st, 2020 minutes, and that's on pages 4 through 7.
Okay. Does anyone have any questions regarding the April 21st, 2020 Policy Council meeting minutes?
All right, just a reminder, when you approve, make sure you say your name, like all in favor, like for instance, Brittany or something, say this is Brittany, so Angel can figure out who approved them. So I need a motion to approve the April 21st, 2020 minutes from the Gateway Head Start Policy Council meeting.
Stephanie Masters approves.
Okay, and I will need a second.
Cy Powell, second.
Okay, all in favor, say aye. All opposed, say nay.
Aye.
Aye.
All right, the Policy Council minutes from April 21st have been approved. And now we're going to go on to the presentation, training, information packet, understanding procurement and cost principles. And that's on page 8, enclosed in the packet.
Can you all hear me?
Mhm.
I was sitting here almost trying to talk and I was muted. These are just some links that you all can actually go to and read about the procurement process and our cost principles that we have to follow with Head Start and Early Head Start. These will also give you frequently asked questions like that are usually things that people may ask about it. So I thought that that would be really helpful on knowing maybe what to ask. And so we actually pulled these directly from our EdClick website. And so you all should be able to go there. And if you have any questions, please feel free to ask me anything after you've reviewed.
Okay. Anyone have any questions on these? Okay, now we're going to go on to the finance report. And that is on page 9 through 77 in your packets.
All right, good morning, guys. This is Rusty Hedrick. Your financial statements for Head Start, Early Head Start, Head Start 2, and Early Head Start 2. Of course, the 2 is our northeastern region there for April and May are all included in your packets. So we will start with our administrative cost percentages. So for Head Start for the month of April, our percentage is 11.42%. Our Head Start for the month of May is 11.56%. Those are, of course, under our 15% mandated amount. Early Head Start for the month of April is 10.18%. For the month of May, 10.31%, still under 15. Head Start 2 for the month of April, 11.19%. For the month of May, 11.43%, under our 15%. Early Head Start 2 for the month of April, 8.26%. For the month of May, 8.91%, still under our 15%. When we go to in-kind percentages for Head Start, the month of April, it's 18.93, which is under our, Christy, correct me, 25%, I believe. For the month of May, 19.87%. Early Head Start for the month of April, 10.04%. For the month of May, 11.84%. Still not at the 25%. Head Start 2 for the month of April, 1.80%. For the month of May, 1.80%. And Early Head Start 2 for the month of April, 0.30%. For the month of May, 0.27%. And of course, those in-kind amount are supposed to be 25% at the end of our fiscal year. Probably be a little bit challenging because of COVID. Christy, were we still going to be able to secure waivers on those, I assume?
So yes, just wanted to let everyone know that we have asked for waivers for the current year on all of programs because, you know, when we left school, then, you know, it was very, very hard for us to be able to gather our in-kind that we normally would gather as being in school. So we've asked for those waivers. I do not think that we've heard back yet, but I feel very comfortable that they're going to approve that. This coming year, they've already allowed us to ask for 0% of in-kind. So on most of the grants. So that is actually good because, you know, it's going to be very difficult until everybody kind of gets back up and running to collect any type of in-kind match for us.
All right, good deal. Now as we move along here, CACFP, of course, the food program, those reports from March 2020 are in your packets, as well as your credit card and charge card expenditure reports for April and May of 2020 are included in your packets. Do we have any questions? Christy's already commented on anomalies that we've got because of COVID and how we're dealing with that. So not a whole lot in those reports otherwise.
Yeah, I wanted to make a point on the CACFP report where you only see from March. That was our last report at this time because, of course, you know, the kids left school. So the we will not have one until we return back to school, for them to be able to actually, be able to be served meals.
Okay.
Okay.
All right. Well, if there's no questions, we'll return to Ms. Elam there.
All right, thank you. All right, I need a motion to approve the financial report.
This is Sai. I make a motion.
Okay. Ms. Powell's made a motion, and I need a second of that motion.
Masters will second.
All right. All in favor, say aye.
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 Opposed, nay. All right, the financial report has been approved. And now we're going to go on to the director's report. That's on pages 78 through 88 in your packet.
Okay, so as you all know, we have been shut down to the COVID-19 pandemic, and that is for all early Head Start and Head Start programs at this time. And we shut down back in March, and so far we have not reopened any of our facilities. Of course, with Head Start, it is now summer break, and so we have been working in collaboration with each of the local school districts. I've reached out and emailed all the superintendents just to inquire about, what their plans are for returning in the fall. And so as of right now, there are so many restrictions and stipulations on what districts are required to do. And of course, daily we receive additional guidance on that. So as of right now, there are no confirmed plans. There are some projected plans for reopening in August for Head Start, for the Head Start program. With early Head Start, you may have heard that the Division of Regulated Child Care has lifted the restriction for programs to reopen as of yesterday. And so after much consideration and discussion with the Policy Council as well as the Office of Head Start and with the management team, we had decided that we did not feel comfortable with reopening our early Head Start programs effective yesterday. And so we are going to reevaluate the process of reopening early July. And so our plan at this time is the possibility of reopening mid-July for those early Head Start children. And so today we actually received an email from the Division of Regulated Child Care that had indicated with some of the reopenings that took place across the state, that there have already been some confirmed cases of COVID-19 amongst the staff in those child care facilities. So that scares me a little bit as we do move to reopening our early Head Start program. And so I wanted to kind of open it up to Policy Council as well. And I would like input from our stakeholders on what you feel about reopening. But before I do that, I do want to share with you that we had a discussion. Whenever I say we, it was myself and the management team yesterday about reopening early Head Start program. And so one of the things that we may be looking at is instead of reopening all early Head Start programs across the 7 counties where we offer early Head Start and every classroom, that we feel that it may behoove us to open up in smaller increments. So for example, if we have a facility located, I'll give Rowan County, for example, we will have 4 classrooms in Rowan County. It may be that we only open 1 or 2 of those classrooms up first and kind of see how things are going, because there are a lot of restrictions and stipulations as far as disinfecting the facilities and so forth as well. And to make sure that, we're going to have staff available to come back to work. We are considering just reopening up in smaller increments instead of, the full-blown early Head Start program. So I want to kind of open it up to you guys though and see what your input and your thoughts and suggestions are as far as reopening the early Head Start, because we are serving 0 to 3-year-olds in those classrooms. So does anyone have any comments or questions or concerns about the possibility of reopening?
I don't know. So will staff be required to wear masks and all that?
Yes. according to all of our guidelines, staff will be required to wear PPE. So, and that really includes the face mask. But in
Mhm.
addition to that, what we have done is we have placed orders, and we're still getting some things in. We've not received everything at this point, but we've actually ordered shoe covers so that the staff, if, tracking things in and out from the ground, they would be equipped with shoe covers. We're also looking at an apron type thing that staff could wear over their clothes. And then, of course, the face mask. And then we would have hand sanitizer readily available for our staff at all times, things like that. So yes, our staff would be equipped. However, with early Head Start and having infants and toddlers, they would not be required to wear the face mask because it's considered a choking hazard for those individuals.
Mm.
So we could have up to 8 children. Licensing says 10 in a classroom, but with early Head Start, we only have 8 children in a classroom anyway. So we would have 8 children, 2 adults in that classroom would be the maximum amount. But of course, with early Head Start, the social distancing requirement really isn't effective because you've got infants and toddlers that's moving around. And so the children would be in our classroom, working with other children and playing in close proximity.
Well, I think it's going to start hitting like in our counties even worse now. It's just now starting to get back here in some of these counties taking off. So it may be more of a risk. Because the parents may not want to, they bring the kids, they may not follow any of the rules.
Well, can I speak for a minute as a parent?
Yes, Stephanie, go ahead.
My concern is that there have been more cases in Menifee County. I do have a 2-year-old who, has a low immune system. I'm not against sending the kids to school, but I think at this time, especially with all the protests and everything else that's going on, that I'm kind of like half and half. The kids do need to get back to a routine and a schedule. But then on the other hand, it's like because so many people, I don't want to say are ignorant, but they don't wear masks. They don't want to protect themselves or others. So it would be putting a lot of people in jeopardy. So it's scary.
Yeah,
I
it
agree.
is very scary, Stephanie. One of the things that we're also going to be doing is contacting all of our families who have children enrolled in our early Head Start program to try to get an estimate on how many families actually need early Head Start services in classrooms right now. And so, because, some of our families have reached out to us and said, I have to go back to work. When are you going to reopen? Because I'm struggling with childcare. And I understand that, but I also understand the risk factors and your concerns as well. And so that's what I was kind of referring to whenever I said maybe opening up in smaller increments, because it could be that, for example, Menifee County, we only have 1 early Head Start classroom. So we have 8 children. If there's only 1 parent that says, yes, I need the service, in-class service, immediately, and the other 7 says, no, I don't want to send my children back right now, it would not benefit us to reopen that classroom just for 1 child. So I understand both ways as well. And I'm kind of in the same situation because, there's so many guidelines that we have to follow with, and disinfecting. And we want to make sure that, the health and safety of our children, our families and our staff remain top priority. Some of the things that we have to do immediately upon arrival is before the children can enter the classroom, they have to have a temperature check, and we will be documenting that temperature check. And then the same way with the staff, we will be, checking their temperatures and, documenting that. And so one of the things that we also have not really struggled with, but have had many discussions about is, what if we end up having staff. And as I had mentioned a while ago, the division has released information saying that there has been some confirmed cases of staff since the reopening of childcare. So what would happen if we did reopen and then we have staff that end up with COVID-19 and then we have to close back down again? So, it could be, a period of reopening and shutting back down within a 24-hour notice. There's so many unknowns with that. But I also want to make sure that our families are getting the services that they need as well. So another option that we're looking at is the possibility, because we've had some of our staff reaching out to families virtually through telephone and so forth, but could they do home visits with the families as long as they were equipped with the PPE, maintain their social distancing and those types of things, and actually go out to the homes and talk with the families, find out what they need. How can our Head Start or early Head Start program support those families during this time of crisis? So
Well,
I don't know if that's an option or not. What are your thoughts, Stephanie?
that would be awesome if there are families that are in need of that immediate support and that connection with the teachers, to have them come into the home. I am comfortable with that. I am all for sending my kids. I'm okay with that. It's just very unnerving and it's scary, because I have 7 kids in the home. So if one happens to get it, then it's going to run through our whole entire family. So that's scary. And then I also have an elderly mother, and there are so many reports from CDC that some say, it will be carried, some won't. Masks work, masks don't. So there is so many unknowns. But yeah, coming into the home and having that one-on-one connection, I know my kids do miss that. They thrive for that. They do need a routine. So that I think would be, if doable, it would be a great option.
Okay. All right. Well, we will definitely take your into consideration. So I appreciate your input on that as well. As an early Head Start parent, it's good to hear from those who, we've been shut down for a period of time, and what your thoughts and feelings are on that as well. Brittany or Cy, do you all have any comments or concerns?
I do think whether we start in June or whether July or August or whenever, I do think a gradual increase is probably the way to go anyway. I have my camera off because it keeps freezing on me. Just because I feel like that is going to help work out some of the kinks and figure out kind of what we have. So I do think, like what you were talking about, opening one classroom at a time and kind of easing into it. And I think the fact that that will probably still work with how many families probably need it. I don't think you're going to need 4 full classrooms immediately. I think that would be a good system for the staff and everyone. I did have a question, and I didn't know, and I've asked some of the child care centers and they didn't know either. Is it possible to have the staff go ahead and kind of take a COVID test before they go back into work, just to kind of see, would that be preventative, or is that something that we feel would be not appropriate to ask them to do, or not a good thing for them to do?
The understanding that I have and the guidance that we've received is that our staff would not be required to have a COVID test unless they had any or one of the symptoms of COVID.
But they could if they wanted to, because I know right now right now they don't have to have symptoms in order to take the test. But I do think that would probably put some of our families at ease if they knew that their teacher, or they knew that we have confirmed that no one going in. But again, I don't think I understand not requiring people to do that. But I was just kind of, one of those things that I was thinking too, is that would kind of help us know what to base, because it really is already unnerving that it's only day 2 and we already have positive cases from staff. That's pretty scary to me, because it's not like we're 2 weeks into it. The child care centers opened on the 15th. I know in-home opened a week ago, but even that's unnerving to me, that even after a week, even if it were in-home individuals that have tested positive. So that's a little bit, makes it, I feel like putting it off till July is a great choice, because that gives us a chance to also see what the child care centers are experiencing. That just kind of gives us an insight. But yeah, I don't think we should try to be rushing it. And if we do go back into the early childhood, that we need to do it in a kind of a gradual kind of way. And I've had several parents ask about it and are excited and want their kids to go back to it, and feels like it's going to be great for their kids and great for them. And so I know a lot of our parents are very eager because that was such a wonderful service for them. But I agree that we need to kind of be very cautious with this, because if it spreads there, it's going to spread very quickly. And these are kind of very vulnerable children. You know, they're 0 to 3. So we definitely don't want them to have to go through something that, if we can help it, that could potentially, you know, be very distressing for them. So I don't know if that was a lot of words. I'm sorry, but I have a 9-month-old too, so I'm kind of like, oh goodness, would I want them to go back? So I'll be honest, my little girl's not going back to daycare till August, because I feel like I wanted this summer over, and I wanted to kind of see how this childcare thing happened and how the kids were doing and what cases we had, before I made that decision. So she didn't go back yesterday. She's not. My plan is August. And honestly, after this information, it may be later than that.
Well, another thing that was mentioned in the email that I received from the division is that, you know, a couple of things that we would be required to do is, one, contact the local health department immediately, and two, contact the Division of Regulated Child Care, because they are tracking the data as well as far as the number of COVID-19 cases that has happened since the reopening of childcare. And so in that email as well, it had indicated that those child care facilities were not required to be shut down. So the local health department did come in, you know, work with the staff on ensuring that they were following the proper protocols for disinfecting and so forth. So that's a little bit scary to me as well, because, you know, as a parent, you know, if I had a child in a program and there were some COVID-19 tests that or new tests or new cases, you know, I would be hesitant to send my child back. And so is this going to affect our enrollment in the event that we did have a COVID-19? And so Stephanie, you're one of our early Head Start parents. And so from your perspective, you know, if we reopened in Menifee County and someone tested positive for COVID-19, would you send your child back if you knew that we followed the proper protocols, we disinfected, those types of things, but yet there was still a case?
I think if there was a case, I think I would probably keep my kids home for the 2 weeks, just to make sure that they did not come down with it and carry it, just to protect everybody else, like the quarantine, at least 7 days.
Mhm. Yeah. And I'm with you. I mean, I see what you're saying, and I would be the same way. And so even with reopening, we always know that there's a risk that we reopen and there may be an immediate shutdown, you know, again, depending on what happens. So I think our families would need to know that in advance. But I also think it's very important that they understand that we are following the proper protocols and that we are, you know, disinfecting and doing everything that we can to prevent the spread of COVID-19. So if you all agree, then we will plan on, you know, just staying abreast of the data, because it may be by July, the division says, no, we're closing childcare back down. So we may not even have an issue at that point in time. But if they continue to remain open, then we will look at the possibility of gradually opening up classrooms instead of opening up the full-blown program. And so hopefully that will assist our parents as much as needed. And then we'll also, Stephanie, look at that home-based option to where staff can maybe go out and support families in the home environment. And I think that's also critical, since we've been shut down since March, you know, especially with our infants and toddlers. They haven't seen their, you know, some of them have not seen their teachers. And so just getting that, building that relationship back and making sure that the children are comfortable before coming back into their program. I think that is the transition process is going to be as critical as well.
Yeah, because my Skylar is 3. So when he left, he was in the early part. And so when he goes back, he's going to have a new set of teachers. So if he can have maybe his older teachers come and visit, the transition may be a little bit more easier for him.
Okay. All right. I appreciate your input. So other than that, that's really what's been going on. We've been working, and you could see on the agenda today, we have several lease agreements that have to be approved. So we've been working in collaboration with the district to ensure that we are moving forward as normal as we can with the pandemic. And so we still have to ensure that we are able to maintain program operations in the event that we go back full blown in the fall. So if you all have any questions regarding the report, I'll be happy to answer those for you.
Any questions on the director's report? All right, now we're going to go down to old business. Is there any old business? Nope. Okay, so moving right along, let's do the new business now. First up is acceptance of the 2021 Policy Council training calendar. It is on page 89 in your packet.
Okay, and I hope you guys could see my screen. And so I have it pulled up. Each year, we look at our Policy Council training calendar because we want to ensure that our Policy Council members are equipped with the tools and the resources that they need in order to be able to make effective program decisions. And so we kept this training calendar very similar to last year. Nothing's really changed with the exception of where we went from monthly Policy Council meetings to bi-monthly. We did make sure that the dates that were listed on the training calendar do align with our Policy Council meeting dates. So does anyone have any questions or concerns? I know virtually it's a little bit more difficult to provide training. So what we've been doing is providing you with links in advance. You get that in your packet. And so you have the opportunity to go to those links, view webinars. There's very short videos on the information. And then that way, when we meet at Policy Council, if you all have any questions or concerns, we would be happy to answer those for you. You know, in the event that you're not able to view those links before the Policy Council meeting and you look at those afterwards, we're still here. So if you have any questions or concerns, please ask so that we can make sure that you have the information that you need.
All right, any questions? Okay, now we need approval of the 2021 Policy Council training calendar. Need someone to make a motion?
I, Brittany, make a motion.
All right, we need a second.
I, Stephanie Masters, second.
Okay, all in favor? Aye. All opposed? Nay.
Aye.
Aye.
All right. The training calendar has been approved. Now we're going to go to the acceptance of the GCA organizational chart. That's on page 90 and 91 in your packet.
Okay, so anytime we make a change with staffing patterns in the office, we have to update our organizational chart. And so on the first page, on page 90, you will see the Gateway Community Action Agency's org chart. And then the next one is the Head Start and the Early Head Start program. And so when you see a dotted line, like here between the, the Policy Council committees and then Dana Elam as the chair, and then you'll see a dotted line between the chair and myself, that means that's a form of communication. Anytime you see a solid line, that means it's actually a supervisory role. And so this has been updated to include the licensing coordinator. The Policy Council and the Board of Directors has approved the job description for licensing coordinator. And we have had many discussions on this, but just to refresh your memory, we have decided to put in a licensing coordinator position because now we have 23 licensed facilities. There is a lot of work that has to be invested to ensure that our license remains up to date. Inspections are completed, personnel folders remain current, those types of things, training and so forth. And so this organizational chart does include that licensing coordinator. And then you will also see over here under the ed managers, we have expanded our education team. And so now we have 2 education managers. Before we only had 1, but with the expansion of HS2 and Early Head Start 2, 1 person was just not enough because as you can see, this individual or this ed manager supervises a lot of people. They supervise all of the teachers, all of the mentor coaches, and the instructional assistants. So one person, that was just too much of a workload for one person. So we have increased that to another ed manager. And then hopefully in the fall, with the approval of our grant applications, we will be adding an additional education manager to that team. So does anyone have any questions or concerns in regards to the organizational chart?
No questions? All right, we need approval of the Gateway Community Action Organizational Chart. Can I get a motion to approve?
I, Stephanie Masters, a motion to approve.
Okay, and we need a second on that.
Brittany Howard, second.
All right, all in favor, say aye.
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 All opposed, nay. All right. The acceptance of the organizational chart has been approved. And now we're going on to approval of Gateway Head Start operational systems. And that's on 92 through 130 in your packet.
Right, so the Early Head Start and Head Start operational systems basically represent the 12 management systems that are critical to sound program infrastructure and high quality service delivery. So when we have a federal review, what they look at are these 12 systems to ensure that we are in compliance with all the Head Start regulations. And so if there is an issue or concern in these areas, then they could deem it a systematic issue or error, and that would put us in a non-compliance or deficient status. And so this document basically outlines the 12 management systems and how we ensure compliance with all the Head Start program performance standards in the Head Start Act. So I won't go through each of those. You've had the packet to review, but if you all have any questions in regards to the systems, I'll be more than happy to answer those for you.
All right, any questions, guys? All right, let's just get a motion to go ahead and approve the Early Head Start operational system.
I, Stephanie Masters, make a motion.
All right, can we get a second?
I saw Powell, second that.
All right, all in favor, say aye.
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 All opposed, nay. All right, the motion has passed. And now we're going to go on to the approval of Gateway Early Head Start written plans.
Let me get to it here.
There's a lot of stuff on here.
There is. And so basically what the written plans document refers to is basically an outline of what our program looks like. So in the event that you know nothing about Early Head Start or Early Head Start, you could go to this document and get a pictorial process of what a classroom would look like or how the program operates. So for example, within the written plan, it talks about the program design and management piece of it. So you could see what our extended day classrooms are, the hours of operation, what double sessions look like, how many children are served within our jurisdiction. It also goes as far as, what our classroom looks like. So if you've ever walked into an Early Head Start in an Early Head Start classroom, you can read this document, get a picture of what that would look like. And then once you enter our facilities, you should be able to see all the things that are written down. So it's an overview of what our classrooms actually appear to be, as well as what our program would look like structurally, from program operations to program design and management.
Now, is this on the website? If you went to Gateway Head Start website, will this be on there?
We will be uploading these documents, Dana, to our website, yes.
Okay. All right, any questions? Nope. All right, we need a motion for approval of the Early Head Start written plans.
I, Stephanie, will make a motion.
Okay, and can someone, we need a second on that motion?
Aye, Powell, a second.
All right, all in favor, say aye.
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 Any opposed, say nay. All right, approval of the written plans has been accepted. Now we're gonna go on to approval of Gateway Head Start full utilization contracts. And that's on page 177 through 183 in your packet.
So what we have included in your packet was just a sample because we have 10 of these documents. And as you can see, they are it's a very huge document. So by the time we put 10 of these documents in here, your packet was going to be very extensive. So we wanted to give you a general overview of what the Head Start full utilization contract is and what it looks like. And so basically what this document does is it has, it's an agreement in place between a Head Start program and the local school district. And so back in 1990, when CARA, state funded preschool, came into effect, Head Start already existed. And so they decided that the state said, well, we don't want to supplant federal dollars to serve children in a state funded preschool program. So we're going to look at the number of children, number of 4-year-old children that Head Start currently serves. And from this point forward, we will make sure that Head Start has at least that amount of 4-year-olds in their program that is funded federally before the state preschool program can pick up and serve any children. And so this agreement just basically outlines, it's very consistent across the board. Some have a little bit more detailed information in it that we've included because it depends upon our collaboration with that school district. But this just basically says that the state funded preschool programs will not accept 4-year-old children until Head Start has become fully utilized, because you always want federal dollars to serve children before state funded dollars serve children. Are there any questions in regards to this document?
All right, if there's no questions, we'll need to make a motion to approve the Gateway Head Start full utilization contracts.
I, Stephanie Masters, will make a motion.
All right, and we'll need a second on that motion.
I Cy Powell second.
Okay, all in favor say aye.
Aye.
All opposed, nay. All right, the motion has been approved. And now we're going to go down to the approval of Bath County Disability Service Agreement. And that is pages 184 through 185 of your packet.
This is the only agreement that we have in place for disability services. It is for Bath County. And as you could see in the contract, we would provide the Bath County School District up to, but not to exceed, $3,000 to provide services to children with disabilities. This agreement actually came into play several years ago. I can't remember the exact year, but we had to work in collaboration with the Bath County Schools and the Kentucky Department of Education. As you all know, Bath County is one of our facilities that are separated from the school district, and so we're out there a little bit as far as where the school districts are located. And so the school district actually has speech therapists and special education teachers, PT, OT, and any other type of services that we need. They come to our facility and provide the services to our children. So in the event that we have children that has diagnosed disabilities and we need those services, we would reimburse the district up to $3,000 to support their travel and so forth for coming to our facility to provide the services for us.
So what other do you have in the other counties?
The other counties, it's basically the full utilization agreement, Dana. It goes back to that because it discusses disability services.
Okay.
And so the district is automatically responsible for servicing children with disabilities once a child turns 3. So in all other districts, that service is actually funded through the IDEA, which is referred to IDEA Act. And so districts are funded for providing those services to children with special needs. So Gateway actually doesn't provide additional support, but they do receive funding from IDEA.
Okay. Any other questions? All right, I need a motion to approve the Bath County Disability Service Agreement.
I, Stephanie Masters, make a motion.
All right, and we'll need a second on that motion.
I, Brittany, second.
All right, all in favor, say aye.
Aye.
Opposed, say nay. All right, the Bath County Disability Service Agreement has been approved. And now we're gonna go to the approval of the HVAC agreement, and that's on 186, 187 in your packet.
This contract is with Hicks Heating and Air Conditioning. As you can see, they provide services to 3 of our counties. That's Bath, Menifee, and Rowan counties. They do annual inspections. They'll come out, if we have an issue, they'll come out immediately. And so we provide them $500 per year or they will provide us $500 a year as non-federal share for the services that they perform for us. But we provide them $1,000. So we pay them $1,000 annually to complete these inspections and keep our heating and air conditioning up to date. And then they give us $500 per year as non-federal share.
All right, any questions on the HVAC agreement? We need a motion to approve the HVAC agreement,
I, Stephanie Masters, will make a motion.
and we need a second on that motion.
I, Cy Powell, second.
All in favor, say aye.
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 All opposed, nay. All right, the HVAC agreement has been approved. We just recently had to get a new HVAC system. It is so much fun.
Yes.
Anyway, now we're going to go on to the approval of the dietitian agreement, and that's 188 and 189 in your packet.
Okay, this contract is with Sandy Ellington, a registered dietitian. Sandy has been our dietitian for several years now. As you can see in this contract, we pay her $45 an hour for her services. She actually reviews all of our menus that we provide, or our food service menus, to make sure that they meet all the compliance requirements. And she gives us $20 an hour as non-federal share. So Nancy would normally, or not Nancy, Sandy would normally charge $65 an hour for her services, but she's giving us $20 of that as non-federal share, and we're paying her $45 an hour. Now, in the event that we have children who are diagnosed as overweight or underweight, Sandy will also come out and work with that child and the family to, set a menu for them, talk about couponing, the WIC requirements, those types of things. And so when we hire Nancy or Sandy, I don't know why she used to be our dietitian, but when we hire Sandy to do that individualized services for us, she's paid at a rate of $90 per hour. And then she will also provide training for us. And so when we ask her to do training, we are paying her $75 an hour for that training. And then, no, I'm sorry, that was for the mental health. So no, let me back up. The dietitian is just strictly $45 an hour.
Okay. All right, any questions? All right, we'll need a motion to approve the dietitian agreement,
I, Stephanie Masters, a motion.
and we need a second on that motion.
I, Cy Powell, second.
All right, all in favor, say aye.
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 All opposed, say nay. All right, the dietitian agreement has been approved. Now, Martina, we're going to go on to the mental health agreement.
All right. This is on page 190 and 195. And so the first one is Pathways, and I was getting my numbers mixed up there. But with Pathways, they charge us $90 an hour for the visits. And so our performance standards requires that we have mental health observations conducted in our classrooms. And then any child who needs mental health services, that we would collaborate with our mental health professionals to ensure that those children get that service as well. So with Pathways, we pay them $90 an hour for their visits, and then we pay them $75 an hour for any training that they provide for us, plus mileage. Pathways provides services to Bath, Menifee, Morgan, Montgomery, and Allen counties. The second contract that you will see under mental health is New Hope. This program provides services to Bracken, Fleming, Lewis, Mason, and Robertson counties. With New Hope, they don't charge us anything for the actual observations in our classroom and for the services, but what they do charge is for the training that they provide to us. So if we ask them to provide training to our staff, whether it's individual or in a large group, if they already have a training designed, then they would charge us $100 per hour, but then they're going to give us $50 per hour back as non-federal share. So we're only really paying them $50 per hour for that. Now, if it's a training that we are requesting that they currently do not have a training plan in place for, and it's something that they have to develop, it would be $150 per hour, but $75 given back to us as non-federal share. So technically, we would only be paying them $75 per hour. So are there any questions?
Martina, can I add something?
Yes.
On the training for Pathways, that is only if we develop a training for you. There are 4 or 5 trainings that the state I do for free. So the majority of the trainings I do are actually free. And I just kind of wanted to, that's only if I have to formulate one and come up with one would we actually charge. There's like 4 or 5 trainings that we could provide for early or for Head Start that actually is a free cost to you all.
Yes. Thank
Awesome.
you for that clarification.
All right, any questions on the mental health agreement? All right, we need a motion to approve the mental health agreement for Pathways and New Hope.
I, Stephanie Masters, will make a motion.
All right, and we'll need a second on that approval.
I, Brittany, second.
All right, all in favor, say aye.
Aye.
Opposed, say nay. All right, the mental health agreement has been approved. And now we're going to go to approval of the Menifee County land contract in Frenchburg and Botts. That's 196 through 198 in your packet.
Yes, and so basically with the Menifee County land contracts for Frenchburg and Botts, we have modular units that sit on the premises at Frenchburg and behind the Botts Elementary School. That land is owned by the Menifee County School District. And so we just have to put an agreement or contract in place with them. But this is a no-cost contract. So they allow us to maintain our modular units on their land at no cost.
That's awesome. So, any questions on the Menifee County land agreement? All right, we'll need we need a motion to approve the Menifee County land agreement.
I'll make a motion to approve.
And can we get a second on that motion?
Powell, second.
All right, all in favor, say aye.
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 Opposed, nay. All right, the Menifee County land agreement has been approved. And now we're going to the next order of business is the approval of Morgan County lease agreement. It's on page 199 and 2 to 204. That's in East Valley, Morgan Central, and Wrigley.
Okay, so as you know, we operate the Care Preschool program in Morgan County. And so we have lease agreements in place with the Morgan County Board of Education for classroom space at each of these 3 local elementary schools. All of these are also a no-cost contract for us. So they provide the space, playgrounds, the cafeteria, everything that we use at these 3 facilities is no cost, but it's calculated as non-federal share. So they're donating all of this space to us at no cost.
All right, any questions on that? All right, we'll need a motion to approve the Morgan County lease agreements.
I, Stephanie Masters, will make a motion.
All right, and we'll need a second on that motion.
Brittany, second.
All right, all in favor, aye.
Aye.
Opposed, nay. All right, the Morgan County lease agreements has been approved. Now we're approval of Montgomery County lease agreements. That's Northview, Margot, Mount Sterling Elementary. And that's on page 205, 206.
Okay, so Montgomery County, we do have a Head Start program that is separate from the local preschool program. But the Montgomery County School District allows or provides us with space at these 3 locations at a reduced cost. So you could see we're paying $300 per month for classroom space, and $350 a month for office space at a rate of $1,900 per month. So a total of $22,800 per year. They provide us with space at these 3 locations. So that is at a reduced cost, and I feel very comfortable with that as well.
Okay, any questions? All right, we need a motion to approve Montgomery County lease agreement.
I, Stephanie Masters, will make a motion.
All right, and we will need a second on that motion.
I, Brittany, second.
All right. All in favor, say aye.
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 Opposed, nay. No nays. All right, then the Montgomery County lease agreement has been approved. Now we're on the approval of Robertson County contractual agreement. It's on page 207 and 209 in your packet.
Okay, so within Robertson County School District, they also provide us with classroom space, office space. In addition, they provide transportation services for us. So this contract is in the amount of maximally $14,000 per year. And I say maximum of $14,000 because it really depends upon how many children they transport for us. And so they only charge based upon the number of children that they're transporting. So if we had a classroom of 20 there, the maximum lease agreement would be $14,000 or contractual agreement.
Okay. All right, any questions? All right, we need a motion to approve the Lewis County contractual agreement.
Robertson.
County, I've moved on, I'm sorry. It's Robertson County. Lewis is next, guys, just to give you a heads up.
I,
So a
Steph-
motion to approve the,
I, Stephanie, will make a motion.
all right, and we need a second.
I, Brittany, second.
All right, all in favor, say aye.
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 Okay. Opposed, nay. All right, the Robertson County contractual agreement has been approved. Now we'll go to the Lewis County contractual agreement. That's pages 210 through 211 in your packet.
Okay, so in Lewis County, we actually have one classroom that is located within Tollsboro Elementary School. The other 2 facilities are separated. And so within that school district, we do provide them $1,000 a year to offset custodial and janitorial costs. And then we also pay them $5,000 a year for lunches for our staff at all 3 of those locations in Lewis County. So the classroom space that we utilize at Tollsboro is actually non-federal share. So this is a very low cost agreement of $6,000 per year.
All right, any questions? All right, we'll need a motion to approve the Lewis County contractual agreement.
I, Stephanie, will make a motion.
All righty, and we'll need a second on that motion.
I'll
Brittany,
second.
second. Sorry.
All right, all in favor, say aye.
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 Opposed, nay. No nays. All right, the Lewis County contractual agreement approved. And now we're going to go on to personnel hiring and resignations. And I guess the list will be, says distributed during the meeting.
Is Rowan County on there?
Is who?
The Rowan County agreement?
Dana, you got the old.
Oh, Dana, yeah, that has been updated. I think there's one more item. It's the Rowan County lease agreement or contractual agreement.
Oh, okay. So next up will be the approval of the Rowan County contractual agreement.
Okay, so I met with Rowan County yesterday, and as you all know, in Rowan County, the Rowan County Board of Education has purchased the new facility. That facility is still under renovation, and so we do not anticipate moving into the new location until maybe December. That's still kind of on the table at this point. So what we have decided to do is run the agreement through February of 2021. That will ensure that 2 quarters are paid for. And so this contract is in the amount of $64,825. That is for all the classroom space, the transportation services. We also provide, janitorial, custodial costs and those types of things to the Rowan County School District as well. So this contract will only run through February of 2021. At that point, if we are in the new facility, we will renegotiate the contract for the remainder of the school year.
Okay. Any questions? Now we'll need a motion to approve the Rowan County contractual contract agreement.
I, Stephanie, will make a motion.
All right, and we'll need a second on that motion.
Brittany, second.
All right, all in favor, say aye.
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 Opposed, nay. All right, the Rowan County contractual agreement has been approved. Now, personnel is next, correct?
Correct.
Okay, so it's going to be hirings and resignations.
Martina,
Yes.
did you stop sharing your screen?
Do you need me to?
I'm not for sure. You want me to go
Okay,
ahead and
I'll
try?
stop.
Okay, can everybody see my screen?
Yeah, there we go.
So for the month of May and June, we have currently no recommendations for hire at this time. Transfers, we have Aaron Angel, Angel Keaton, Felicia Colvin, Tiffany McGlone, and Ashley Kahn. And resignations, we have Chelsea Sloan and Sandra Gunder. So I know that for as far as recommendations for hire, we are actually interviewing for our early Head Start positions this week to ensure that our staffing is up and ready and prepared for a future or near future reopening date in July. So if anybody has any questions, feel free to ask.
We'll need to get approval, right? We've talked about this, I think.
Yes, we need to make a motion, and just a reminder that what you are making the motion for is to approve the process that the agency went through to ensure that any type of hire, transfer, or resignation followed our internal processes. And as you can see, there's no hires right now, but I do want to point out a fact for you guys to know about. With the COGS system, the Kentucky's Online Gateway, and the fingerprint system that we currently utilize, that is shut down due to COVID-19. So we have received guidance from the state that indicates that that we will be utilizing the old system temporarily for background checks. So we still won't allow those individuals to be left alone with children, although we will have a check one file for any new hires moving forward. But once that COG system is back up and running, we will make sure that anyone that we hire between now and until that reopens are entered into that system, and we have a complete check one file for them before they're left alone with any child. But transfers is just basically if we have openings internally, then and staff want or wish to transfer into different positions, then they could request that. So this is the recommendation that we're making for those transfers.
All right, any questions? All right, I'll need a motion to approve the hiring, the personnel issues process for early Head Start and Head Start.
I, Stephanie, will make a motion.
Okay, and we'll need a second on that motion.
I saw Powell second.
All right, all in favor say aye.
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 Opposed, nay. All right, the hiring and resignations have been approved. Now we're going to, I guess there's some enclosures in your packet, Martina, for everyone to see.
Yes, it's just, it's the enclosures. You've got the board, the March 12th, 2020 board minutes that were approved. There's some information memorandums and program instructions from the Office of Head Start that has been released in regards to fiscal flexibilities, the supplemental funding, and of course, COVID-19. And then lastly, in closing your packet is the self-assessment update. It's been a little while since we talked about our annual self-assessment. And so I always want to ensure that the Policy Council and the Board of Directors have an update as to where we are on completing any identified concerns. And so you could see, let me scroll down here to it real quick and let me point out something to you guys. In the self-assessment report, if you go down to our findings or area concern, you will see when our projected month and year was to have that complete. And anything in March, anything marked in red is the actual month and date that item was completed. So you could see that we are on track. There's still a few things in progress, but of course, some of those are delayed due to COVID-19 and our inability to accomplish some of those tasks. But we are, we have them on our planner, and we'll get these projects completed.
Okay.
If you have any questions, I'll be
All
happy to answer those.
All right, any questions? Anything else you want to add, Martina?
No, that's, I will keep everyone up to date. That's really all I had on the agenda today. But, you know, as you know, there's lots of supplement funding that's coming down the pike through, you know, the federal government as well as licensing. And so there are restrictions on all of those dollars. A lot of it's going toward PPE. And so it looks like we're going to have lots of funding to purchase all the protective equipment that we need. It's just a matter of things are being on back order and, you know, in getting those things in a timely manner. So I will keep you all abreast of, you know, any type of funding that's available and what we're doing there. And then I'll also I'll send out an email to the Policy Council letting you all know of the decision we made as far as the gradual opening of the Early Head Start program.
Okay. Martina, I was just going to say, as far as like the shoe covers and stuff, I know at the prison, they have disinfectant that they have to step in before they step into the facility. That might be something to look into.
You know, I seen a video on that the other day, Dana, but I don't know what that is. Can you find out what that is? And maybe we can look into it and see if it's approved for child.
It's something that might be cost, you know, cost wise. Yeah. Okay. Anything else, guys?
I have a quick question.
All right. I need a motion.
Wait a minute. Somebody's got a question.
Okay. Go ahead.
I have a quick question. I know typically when we attend these meetings, you all get in-kind credit, and I didn't know how that works with it being video. And also, if you are able to get in-kind, do we get to count the hours that we looked at the agenda and did all of those types of things prior to this meeting? Because I know I've not got to sign anything lately, and I want you all to get credit.
Yes, thank you, Pal, for bringing that up. Yes, we are tracking it. So you will still count the time that you spent on reviewing the packet as well as the time that you participated in the actual meeting. And so Angel is tracking all of that. So as soon as we get back together, she will have the forms for you guys to sign. So we still have everything and we're still able to calculate it. It's just we've not sent it to people because some folks don't have the capability of signing documents and sending them back to us. But if that's something that you have the capability of, then we could definitely go ahead and send you those documents to sign and you can send them back.
I'm fine with however you all want to do it. I just wanted to make sure that if I needed to keep track of the hours for you, or if you all were doing it, I just want to make sure you were able to get it. So I want to make sure I was doing my part.
Yes, absolutely. Thank you for bringing that up.
All right, anything else, guys? All right, let's be safe out there. Wear your mask. I need a motion to adjourn the meeting.
I'll make a motion.
And I'll need a second.
Brittany, second.
All right, all in favor of adjourning, say aye.
Aye.
Opposed? Nay? All right, the policy council is adjourned.
All right, thank you all so much.
Thank you, guys.
Have a good afternoon.
Uh-huh. Bye. Martina, I'll sign those and send those in the minutes.
Okay, thank you.
Okay? Uh-huh, thank you.
Bye-bye.
Bye. Gee.
Bye, Dana.
See ya.